Okay, so this morning I'm extremely excited to introduce Dr. Kate Gabowski. She is currently an assistant professor in the School of Medicine and Department of Epidemiology at Johns Hopkins Bloomberg School of Public Health. And her research interests probably currently and also, previously focus on epidemiology and transmission dynamics of sexually transmitted viral infections like HIV, HPV, and HSV. Looking at sexual network structure and associations with viral STI transmission dynamics and also viral phylodynamics. And our current research is focusing on elucidating the geography of community-based sexual networks to inform targeted HIV control in Rakai, Uganda, using HIV phylogenetics, network epidemiology, and dynamic models of HIV transmission. The way she uses these methods, for example, to kind of identify targeted interventions. One of her studies identified that HIV introductions into communities are common and account for a significant proportion of new HIV infections acquired outside of the household in rural Uganda, suggesting that HIV prevention efforts should be implemented at spatial scales broader than the community and should target key populations responsible for those introductions into the communities. She also works directly with the Rakai Health Sciences Program and has analyzed the really comprehensive survey data set that they have from the large community cohort study there, identifying just recently key progress in HIV prevention programs within the community, noting a 42% decline in incidence over almost 15 years. As many of us, she now has branched into COVID and has carried out studies to understand the immune response to COVID-19 as well as transmission pathways, and also coordinated discussions amongst modelers. I think this was kind of late summer surrounding university reopening modeling plans. And alongside these endeavors, she's also been working with the novel coronavirus research compendium, to which many of you may recognize. We've cited a number of their rapidly curated review of emerging scientific studies for COVID-19, which I believe is what she'll be speaking with us about today. So with that, I'll let her take it away.
Hi everyone, thanks for having me. It's a pleasure to be here, and that was a very nice introduction. It made me nostalgic for all the work that I used to do last year. So as Spencer noted, I've been working with the novel coronavirus research compendium, or what I'll just refer to as an NCRC for short. The NCRC is really a team-based effort. I co-direct it along with Emily Gurley, who's an associate scientist at the School of Public Health at Bloomberg in Baltimore, along with myself. So this whole initiative started back in April. We were getting requests from people working at the School of Medicine, the Baltimore City Health Department, Maryland State Department of Health, to summarize the key literature and the findings, just like you've all done here, as they were coming out, because people just wanted to stay ahead of what was happening in the literature, and it was coming so fast and furious. There was a deluge of publications and preprints, and people were having a really hard time keeping up. The available evidence was really of varying quality. I think that still stands today. We were seeing information come out from preprints to top tier journals, and the preprints, as you know, are not peer reviewed, although to be honest, I'm not sure. That makes a big difference looking at the peer reviewed literature for a long time myself. So the issue is that these folks who are working on the front lines, who are working in hospitals, who are working in public health departments, do not have time to go through thousands of articles that are emerging each week, read the literature and pick out what's actually good. They may not even have the skills to be able to do that. And so they had independently, approached me and had approached Emily through different forums, and we're like, oh, well, maybe we should start just kind of doing a little curation effort. to kind of solve this issue. We can give them little weekly updates on what's happening, and then ultimately, and it ended up morphing into this really sort of large initiative, which is now the NCRC. So our solution to all of this at the NCRC was to do frequent comprehensive searches of publications and preprints to identify new evidence, to curate a list of papers that we thought were most important, and that really added to the conversation across 8 different topic areas, which I'll mention in a minute. And then to do kind of like mini reviews, not really extensive reviews like you might do for a manuscript, but to do summary reviews that highlighted the key findings, the limitations, the value added of those studies, so that people who are working on the front lines could really understand them. And so we were kind of focused on science communication for people who had not necessarily not the lay public per se, but people who maybe had an MPH level background. That was our target audience. And so these are people, public health people and clinicians responding to the pandemic. And that's really key to keep in mind as you think about our reviews and who they're really meant for. We have a lot of academics who use them as well, and a lot of other folks, but our target audience are really these frontline public health persons. So as I mentioned, this is a huge group effort. We have greater than 60 faculty, postdoctoral fellows, and doctoral trainees working on this project. Most of them are at Hopkins, but we have people who are also helping us out of Imperial, Boston University, Stanford, Harvard, Vanderbilt, University of Florida, and more. So the team is pretty big, and it's about as big as probably we can stand. But we've had people transition on and off the team, and we're always looking for more volunteers. So if anyone's interested at the end, please let me know. So this is our main group. So as I mentioned, we do reviews in 8 different topic areas. Those topic areas span infectious disease modeling, diagnostics, epidemiology, non-pharmaceutical interventions, pharma interventions, clinical presentation and risk factors, ecology, and spillover and vaccines. And we don't cover everything related to all of these topics. So each group, as indicated on our website, has a very specific area within these fields that they cover. So for instance, I work a lot with a group that covers research on non-pharmaceutical interventions. And there is a plethora of literature on the impacts of non-pharmaceutical interventions on human health conditions that are not related to COVID-19. We have chosen not to cover those studies. So we focus specifically on impact studies on COVID-19 outcomes. So our scope, we have a slightly narrower scope within each of these topic areas that was defined by the groups who work on them. And the way it really works is our 60 team members are not split across all these groups. We have each of these 8 team members has a faculty lead or 2 leads, and then they have a group of trainees that work underneath them. And those trainees will write the summaries, and then the faculty members in the group will review those summaries and read the paper themselves to make sure that the summaries are accurate and reflect what's in the manuscript. And so I'll go a little bit more into the process in the next coming slides, but I just want to emphasize that this is also not just a review and curation effort, but it's also a training activity for our students and postdoctoral fellows. So, as part of this, when we were doing this curation, we realized pretty quickly we needed to automate it. There was so much literature coming in, thousands of articles a week. So we worked with a librarian and some folks in the Department of Biostatistics here at the School of Public Health to automate searches across PubMed and preprint servers. So we searched medRxiv, bioRxiv, and SSRN. And then we automated those searches and had the searches import into a Shiny application. We will also cover articles that are not necessarily in PubMed or in these preprint servers. If they're coming up in different forms, oftentimes we'll see policy papers or briefs that are put out, some of the Imperial College reports that are not necessarily uploaded to these preprint servers. We will pick those up, and we will cover those as well as needed. So the articles that do get picked up through our automated searches go into this app, and then they undergo what we call a triage process. And so, as I was mentioning, the groups have specific mandates of what they're going to cover, and they will go through and they'll screen thousands of articles a week, and they will pick out the articles that really have original research in them, articles we think are adding to the conversation. So, so today we just had a meeting with our MPI group, and we had a meeting with our sorry, one second, please. So we had a meeting with our MPI group, and we were discussing whether or not we should continue to cover mask mandate articles that show declines in cases after mask mandates were implemented, because we've covered like 10 of those already. So so we try to cover information that's novel, and then once we triage, the students will actually do the reviews, the initial reviews on the articles. The faculty will examine and approve those reviews. We call the reviews expert summary sheets, or ESSs. And then what happens then is that those ESSs will get entered into back into the app through another tab, and we'll go to a whole separate application for copy editing by a faculty scientist here at the School of Public Health. So she's reading through to make sure everything makes sense. And then all of these things get automatically uploaded onto our website, which was kindly developed by Bloomberg Philanthropies. So it's quite a process, but we have it down, I think, pretty packed now. So this just gives you a sense of what the app looks like. You can see, you know, we have 4 different tabs here. So if you were in the clinical presentation group, you would click on your group, and then there'd be a list of papers here. You know, you might have like 300 or 400 a week, and the abstract comes down, and then you would decide down below this abstract whether or not you wanted to review it or not. And then you would go over to the review tab. If you did select it, enter your review. Sometimes the articles span multiple disciplines, so a lot of articles you know, may have modeling or heavy statistical components, so we will shunt those over off to a different group to do a secondary review in case, you know, we're concerned that we might not be picking up the right information or reviewing everything. So typically we have like for more controversial papers, or for papers that have are really heavy on methods, we will have like maybe 2 or 3 faculty members reviewing those papers, sometimes more if they're really controversial. So our review contents include a number of different components. We have keywords. We summarize the study design briefly. We summarize the study population and methods, the key results. I think really where our reviews make a difference are that we discuss the limitations, what the strengths of the articles are, and then we put it in context with what the current literature is. So what's the value added here? And then we also do these little sections called final takes, and those are basically like 1 short paragraph summaries that kind of tell you what the take-home message is of everything. And as I noted on the prior page, we do review all of the summaries as they come in for technical issues and content and you know, typos and all that kind of stuff before they get posted to the website. So this is just an example of what you might see on the website when you click on it. And then, as I mentioned, we have these final takes, which are these comprehensive takeaway messages. You can see that these are in these green boxes here on the website, and these really summarize the main findings, the major limitations, and the value added of the study. You know, I mentioned that there's been a deluge of articles in the beginning, and it is real. As of January 1st, 2021, we've screened over 54,000 papers, approximately 24% of which have been preprints. We have only done reviews on 527 articles and generated summaries for them, and approximately a quarter of those are preprints. So we're equally covering preprints as they're appearing in the searches. Peer-reviewed publications that have been reviewed by the NCRC are 395 and have been published in more than 102 different journals. So we are covering journals beyond the big ones. But I will note that a lot of the articles that we do cover in the peer-reviewed literature are coming from the big journals themselves. In particular, MMWR, Lancet, JAMA, the Nature journals, NEJM, Clinical Infectious Diseases and Emerging Infectious Diseases. So that's where I'm surprised Science didn't make it onto this list, because I feel like we've covered a lot of science articles, but maybe they're a little bit further down. So in addition to having the website, we also do a weekly newsletter, which I would encourage all of you to sign up for. So we have a newsletter that summarizes all the articles that we've covered over the last week. We have slightly more comprehensive summaries in the newsletter, just because most people will just read the newsletter and not really click and go to the website. So we wanted to give them a little bit more information. We have had thousands of visitors to our website from all over the world, so more than 50,000 since we've started the website, from 180 different countries. And we have about anywhere from, like, it depends on the week and what we've covered, but we have anywhere from 3,000 to 7,000 users using the website a week. So we have so our effort has attracted a lot of interest from people involved in kind of promoting preprints and review of preprints. So we've been asked to speak in a number of different events by ASAP Bio, Society for Scholarly Publishing, others, on this curation effort, because they've been very intrigued on how we've gotten faculty members to do reviews for free, particularly of preprints. So in one of these events, we ended up connecting with eLife, who is starting a new platform called Society. And Society is this network where, and it goes beyond COVID-19, but they're trying to organize people to do expert reviews of preprints and really promote reviews of the early literature through their new website. And so they've partnered with us and are now partially funding us to continue to do these reviews. So, there's been a lot of lessons that we've learned through this process. The need for rapid and reliable information continues. I think we're all especially seeing this today as we talk about variants and vaccines. We have found that it can be often very difficult to reach our target audience. These are busy people who don't have a lot of time, and getting the information out and letting them know that this resource is here has been somewhat of a challenge, but we've been trying different avenues to do that. We have incredible dedication from our team members, but like everybody, they are exhausted by all things COVID. And all of the faculty members are doing this for free. So we pay our students, but we do not have funds to pay faculty members to do this. And so it's been a challenge keeping people motivated when you're not paying them. These efforts are also challenging to fund. Like our effort doesn't really lend itself to typical scientific grant mechanisms that we're used to applying for. We've reached out to philanthropies, some of which have been generous, but it's difficult to find the time to fund faculty salaries for this. What we've also learned through a lot of our interactions with the preprint community and working with some of the institutes, including Chan Zuckerberg Institute, is that this kind of model of having this kind of model where you have teams and you have applications and crosstalk between teams can be used to solve other health problems. And so, right now, eLife is kind of using our platform, our web application, and redesigning it so that other societies could potentially use it for other disciplines. So I just want to mention, like, I asked the team before I came here, I'm like, what do you think are the big gaps in each of the 8 topic areas that we're covering? Like, where do we really need more information? And these were the responses I've gotten. So from the clinical team, they said, we know a lot, about what the risk factors are for severe COVID outcomes, but, it's still the variance in who gets really sick and who doesn't is still pretty poorly explained. And I think particularly the literature on the biological kind of determinants of variation in immune response are poorly understood. When people have looked under the hood, they've found, these type 1 interferon autoantibodies that are highly correlated with severe outcomes, but there's still a lot of research that needs to be done in this area. In terms of long COVID, we don't know what percentage of people who get infected with COVID or with SARS-CoV-2 ultimately develop long COVID. We don't know what their trajectories are. So there's still a lot of work to be done in this area. With regard to MPIs, I would say we really don't need another study looking at mobility data and showing that as mobility decreases, infections decrease. We have a million studies on that. The ecological studies are endless. What we have little data on are individual and household level effectiveness of MPIs, particularly within schools or restaurants where these MPIs have been implemented. I think community sources of transmission, what attributable fraction of transmissions are coming from different community sources, are poorly quantified. There's still a lot of debate on the efficiency of spread among kids, as you all know. Mechanisms underlying super spreading, we've seen a little bit of evidence emerge on that in the last few weeks, but that's also poorly understood. Our folks working in diagnostics tell me that validation of serologic assays in diverse populations over the course and spectrum of disease really need to be done. We've seen with some African studies that are emerging that we have really high background rates of false positives, indicating that we really need to be doing studies in other populations. Obviously, vaccines and transmission, variants and reinfection, and data on pregnancy are still needed as well. So these are just kind of a summary where we think some of the key gaps are at this point. So, if you're interested in learning more about NCRC, please visit our website and sign up for our weekly newsletter. We also have a Twitter hashtag where we tweet out some of the more intriguing articles that we cover each week. And if you're interested in getting involved with NCRC, please feel free to reach out to me. I would love to have any of your expertise. So I'm happy to take any questions. And again, thanks for the opportunity to be here.